everyone, thanks for joining us today. If you've been tuning in to some of my daily updates, you might have heard a voice behind the camera. And I'm excited to bring her out in front of the camera today. This is my 9-year-old daughter, Asha. And she's been really interested in learning some of the science behind the COVID-19 epidemic that we're all stuck at home for. And so we thought it'd be fun for us to share some of our questions with each other and hear from you as well about what's on your mind, about the questions that you have around the science of this disease. So Asha, why don't you start us off with one of the questions that you've been asking?
Right. So where did the virus come from?
Yeah, so where did it come from and how did it kind of happen all of a sudden, right? So we know is that the first instances of this disease happened in China, and we think that it originally happened in bats, right? So bats actually have a lot of different viruses, and every so often one of those viruses can actually jump from bats to humans. So you were wondering too that, okay, why is it just in humans, right?
Yeah, like, does it just affect humans, and are humans, like, have something that attracts the virus that no other, like, plant or animal has?
Right, that's a really good question. So let's break that down a little bit, right? Because one of the things that we know about how viruses make us sick is that, imagine that a virus is like a key, right? Mm-hmm. And the key has to fit into a lock. So not all animals have that right lock, and the key is constantly changing. So just because it's a certain shape in bats doesn't mean that it always has to stay that shape. It can change a little bit here and there. And as it changes, sometimes it finds the right lock. And in this case, humans happen to have that right lock for the key to fit into. But we've been talking about, like, okay, what happens in pets? So it seems so far that maybe dogs and cats, they just don't have a lock that fits the key as well. And so luckily for us, as we're snuggling our pets at home, they don't seem to get sick the same way that we do. But looking at other animals, it seems that the virus may have started to spread to other animals and then jump to humans. All right, so we have a question here that I think is a very practical question. You want to read it?
Sure. Does it matter if the water is hot or cold when you're washing your hands?
Yeah, so hopefully everyone's washing our hands really frequently these days. It turns out that from the point of view of soap, it doesn't really matter. But what do you think? Would you rather be washing your hands in hot or cold water?
I would personally like to wash my hands in hot water.
I know, you're always cold, right? So the answer is, use whatever water you have. If you only have cold water, you should use cold water, right?
That's better than nothing.
Better than nothing. But if you're more likely to wash your hands thoroughly, and how long do we wash our hands for now?
20 seconds.
20 seconds. Then, use hot water that's comfortable for you. That'll definitely keep your hands under there for the full 20 seconds. Okay, we've got another question. So tell us who's asking the question. Corinna, yeah.
Corinna, she's 7 years old. So why does the virus have so many bumps?
That's a really great question. Thanks, Corinna. So we've seen all these pictures of the virus where it's kind of like this shell, and what's coming out of the shell?
A big, like, bump.
Yeah, like these spikes coming out of the shell. And that's what this particular family of viruses looks like. And the reason is that they have these little spikes coming out of the shell, and that's actually the key that fits into the lock in our cells. So that spike coming out is actually the most important part of the virus in terms of why we get sick. Without that spike, it wouldn't be able to fit into our cells the same way. And what we know is that that spike is also where scientists are trying to look at places to shut down the virus. So those bumps that we see in these pictures of the virus is a really, really important part. All right, let's talk about some, as we're waiting, we came up with all sorts of questions to talk about. So keep sending us yours, but Asha, why don't we get to one of your other questions?
You want to ask this one?
Okay, so let's talk about this one.
Yeah.
So one of the things that we've been hearing is the fact that kids don't seem to get as sick as adults. So what have we learned so far?
So we've learned that usually that's because of our immune systems, and that I've learned that kids' immune systems tend to be a lot stronger than adults' immune systems, which is why adults seem to be getting it a lot more than kids do.
That's right. So just to so let's talk about that a little bit. So it seems that adults and kids, we can all get the virus, right? So, but adults get sicker than kids do. We don't see as many kids having to go to the hospital. A lot of times it seems like kids don't even have any symptoms at all. And we can think about your immune system kind of like your brain when you're a kid, right? Like when you're a kid, you're just learning all about the world and trying to, store things to remember that'll help you long term. Your immune system's the same way. When you're a kid, your immune system is learning about all kinds of different germs and storing them away in case it has to protect you from them later. Grown-ups aren't so good at that. You know how we kind of forget things from our brains? We're not as good as learning things. Our immune systems also are less good at learning new things than kids are. And that's why scientists think that kids are getting less sick than grown-ups. Okay, we've got lots of questions coming in here. Let's talk about this one, because we started talking about bats and animals, right?
So this one is from Sophia. She is 9 years old.
Okay, so how did bats or animals actually transfer to humans?
Right, now that's a good question I was asking myself, because it's not like bats are going to come up to us and breathe all over us to spread the virus, right? So usually it's because of bat dung.
So it could be because of poop.
Yeah.
Right?
So
from animals. But we also know that bats might have transferred the virus to other animals first.
Right.
And when humans come into contact with those other animals, there's a really cool animal called a pangolin that scientists think might be involved for this particular virus. That, when humans eat these kinds of animals or when we are sharing a space with them, they might leave their germs in places that humans then come into contact with. And so if you are, so one of the places that scientists think that this virus might have been transferred is a really busy marketplace in China where people are selling and coming into contact with all different kinds of animals. And it's not too hard to think about how you might have touched a germ, somebody might have touched a germ, touched their face, and then as that virus keeps changing over time, it figures out, it starts to change in a way that makes it more likely to get people sick. All right, I think this one's a really good question because we're seeing, so do you want to ask it?
Sure, so this one is from Logan and he is 9 years old. So why is it red and gray?
Yeah, so we've been seeing pictures of this virus all over the news. And it kind of looks like, in a lot of these pictures, that it's this gray virus with red bumps coming out of it.
The spikes that we talked about before.
Right. Turns out that viruses aren't actually colored. When scientists make pictures of things that are too small to see, we often give them just fake colors just to help us visualize what it might look like. But in fact, these viruses are so small that they're even smaller than light, right? So, light travels in a wave. This is so small that a light wave would just pass right over it. And so it's just colors that help us think about what it looks like.
So this is from Ellie. She's 8 years old. So why do the viruses make you so sick?
Yeah, and this seems to make us even sicker than some other viruses like the cold. And one thing that scientists have figured out is that this virus is especially sticky to some of the cells in our respiratory systems. That's the part of our body that helps you breathe. So the part that goes down to your lungs, your nose, your mouth. And when the virus starts to attack that part of your body, it makes it harder to breathe. And so that's what we see happening is that, with mild symptoms, people might have some trouble breathing, but especially with older people or people who have other things that are making them sick long term, it gets harder and harder to breathe, and that's the biggest problem that we see. We tend to see people getting pneumonia, which is a word for that we call have an infection in their lungs.
Can I answer this one?
All right. Do you want to answer the next one?
Sure.
So Audrey, who's 11 years old, is asking, how does COVID-19 spread so quickly?
So COVID-19 spread a lot more quicker early on because this is a new virus. Not a lot of people know about it. So they don't know to be 6 feet away from people like we do now.
That's right.
It's going to spread quickly because when you think about the marketplace in China, people are just going to be crowded. People are going to be close together, and even without meaning to, they're going to be breathing on people and bumping into people.
And that's part of the issue even now is that the symptoms of being sick take, up to 14 days to actually show up. And so any of us could be walking around being sick and spreading the disease without knowing it. And so that's one reason it's really important, Asha. I want to talk about this because we can't blame any one person or any one group of people for this disease because this disease has come from just interactions with people and the environment that we live in, and we all play a role in thinking about how we can keep it from spreading even more.
Right, and when you think about a couple of the episodes ago when we were talking about the bump of people of getting it, it was much higher early on, and then you notice that it was getting lower as people were getting more aware and more wary of going out and talking and hanging out and not virtually.
That's right. So right now, because nobody it's most of us have never had this disease before, so we can all get sick. And so the reason that you were saying about why it's important for us to stay apart from each other is that if lots of people get sick at the same time, then it's really hard for doctors and hospitals to keep up with helping people get better. But if we can kind of push it out over a longer period of time, then we're much better prepared to help people who are sick.
So this next one is from Will, and he is 6 years old, and he would like to know, so can it make people under 50 really sick? Why is it just the older people that are getting sick?
That's a great question, Will, because what we're seeing, and this is why it's so important to look at what's happening in all different countries, is that originally we thought that it was mainly older people getting sick. But what we're seeing now is we're looking at data from Europe and the US that it's looking like younger people, especially, thinking about 20 to 40-year-old people, we're getting sick too. So we don't know for sure yet why certain people might be more likely to get very, very sick from the disease. But it does seem like, the people who are older tend to get sicker and then more likely to die, unfortunately. Let's go to this one, right? Because you had that question too, right?
Do you want to ask her?
Yeah, so Nita, who's 4 years old, is asking, does COVID-19 affect plants?
So, no, in short. It does not, because like we talked about before, it doesn't have the right lock for the key.
That's right.
So all the cells that the virus needs to come up and affect somebody or an animal just doesn't appear in plants.
That's right. Plants have their own set of viruses. So it's not like plants can't get sick from viruses, but there are different viruses that infect plants versus animals. Okay. These are two similar questions. So let's talk about those two together.
So the first one is from Cassandra. She is age 10. So what does the virus do? How does it act?
And along with that, Zakir, who's 8 years old, is asking, does it have an effect on people's brains? So scientists have been looking at where this virus looks like it sticks in the body. Again, we've been talking about this lock and key, right? And what do we know about where it sticks?
So like we said before, it is mostly, the effects of it can go into pneumonia, which is from the lungs. So we would assume, and we pretty much know, that its effects are coming into play when the virus reaches your lungs.
Right. So there's no evidence that it does anything to your brains, thank goodness. No like zombies walking around from this disease. But we do know that it really affects parts of our bodies that we use to breathe. Okay.
So
this is a great question here. Lincoln and Anya
would like to know if the foods we eat matter.
No, again, so this is a virus that's really transmitted mostly through what we call respiratory droplets. And that's a fancy word for saying like the spit and the snot that comes out of us when we cough or sneeze, or even just when we talk or breathe. So the food that you actually eat is important in terms of just keeping yourself healthy, right? You want to be eating a healthy diet just to keep your immune system going, so that if you do encounter the virus, you're ready to fight back. Oh, this is a great question.
This is from Zach, who is 7 years old, and Kay, who is 4.
And the question is, will we have to get a shot before we go back to school? And what happens when you get a shot? What kind of shots do you usually get?
So when you get a shot, what usually happens is the cure or the vaccine for whatever virus it is transmitted into your body.
That's right.
From the shot.
So there's a little bit of a difference that's important between a vaccine and a cure. A vaccine is like just getting a little tiny bit of the disease, or a part of the disease, that's enough to help your immune system learn about it and fight it off if you ever encounter it again. So it's a little bit, you get a lot of shots when you're babies. Again, that's to help your immune system learn. Now, scientists are working really, really hard on coming up with a vaccine, but the process of making sure that a vaccine is safe and that it actually works takes some time. We think that it might take a year to a year and a half before we have a vaccine that's ready for everybody to get a shot. So it's unlikely that that'll be ready by the time you go back to school. And especially since that when you'll go back to school is still kind of an open question. But hopefully within a year and a half that shot will be ready and we'll be able to give it to lots of people. All right. Let's talk about this one from May.
Okay. So, and she is age 10. So, will the virus get worse before it gets better?
That's a question that I think is on everyone's mind. And we're in a question. We're in a phase right now where there are questions that nobody knows the answers to.
Right. And from the way it looks right now, like we talked about before, the lump of people getting sick, mm-hmm. and then people who are getting more aware and not getting as sick. So we can assume that it has been much worse than it's going to be, because it's spreading super duper fast, and it was spreading much more quicker when nobody knew that it was happening and nobody knew that what it was.
I think you've hit on a really important point, Asha, which is that the more we know, the more that we can all keep it from getting worse, right? And this is why it's so important for all of us to stay inside and stay 6 feet away from each other. Because really what each of us does in helping to keep the disease from spreading will make a real difference. And we can look at how many people are getting infected, and sometimes it's kind of hard to understand what the numbers mean. They seem like really big numbers, and the more we test people, the bigger those numbers are going to get. And that's kind of scary to see in the news sometimes. But I think the thing that we can all keep in mind is that as long as each of us is doing our part, and we're helping make sure that everybody else knows to do their part, we can all help. Yeah. All right. This is a good one, right?
So
it's a very practical question.
Sophia, she is age 9. Why does our lungs fill with liquid?
Yeah, so one of the things that doctors are seeing with people who are getting so sick that they have to go into the hospital is that when you take scans of a patient's lungs, you see these spots that look like there's just fluid building up. And that's partly because your immune system is kind of kicking into overdrive, right? It's really trying to fight this off, and as it's doing that, your airways in your lungs are starting to get narrow, and so things aren't getting through as much, and your immune system starts to cause swelling in parts of your body, and that has some fluid and other junk that starts to build up with it, and the more that builds up, then the harder it is to breathe. So this question from Sarahi, who's 10 years old, I think is a really practical question.
Which is better for coronavirus, hand sanitizers or soap and water?
So, hands down, which one do you think wins?
I think washing your hands.
Soap and water, that's right. So soap is kind of this like super vaccine killer, and it's so cheap and easy to use, which is why we have such an effective way to make sure that we clean our hands. So soap is really cool because soap has one end that can slip its way into that shell of the virus, and one end that sticks to water molecules. And so what soap does, as you scrub for 20 seconds, that one end is able to bust open that shell of the virus and kill the virus, and then it traps those loose pieces of virus, you rinse your hands under the water, and it goes away. Hand sanitizer works in a pinch, but what's the problem right now?
We're low on it.
Yeah, it's hard to find. And so if you're out and about, having a hand sanitizer that is at least 60% alcohol is effective, but soap and water is really the better way to go.
Okay, so why does this is more for the soap and water? So you said that the molecules in soap stick to the water molecules?
Yep, one end of it, yep.
One end of it, right? So why is it that they're just washed away instead of having the virus come along with the soap onto some other part of your hand?
Right.
Like while you're still washing.
That's a good point. So one of the things is that the actual scrubbing that you do with your hands, that physical action lifts up the virus particles from your skin.
So it doesn't land back down because it's, like we said, it's a sticky virus.
Right. The more you rub your hands, the more that soap is going to just make these little traps that pull the virus off your skin. So don't just kind of go, right? You really scrub your hands for those 20 seconds. Okay, so let's talk about this one. I think we've talked a little bit about why some people have no symptoms while other people are dying. And this is, I think, the $1 million question, probably more than $1 million question, right? Because we don't have a good sense of why it affects some people and not others. We're even seeing more and more cases of people who are otherwise healthy. So that's a question that I don't think anybody knows the answer to. Let's talk about this one.
From Aubrey?
Yeah, from Aubrey.
Okay, so, and she is at age 7. Is it safe to eat takeout food?
Yeah, so when we're stuck at home, right? I think your brother was talking about how he kind of misses going out to eat. And so there are a lot of restaurants that are staying in business now by doing takeout, and is that safe? And for the most part, as long wash your hands after you touch anything that comes in from outside. But restaurants are doing a really good job, trying to keep everything clean. And just like going to the grocery store and bringing groceries in, bring everything in, wash up before you eat, and you'll be fine. So let's talk about this one too. For another one from Sarahi,
who is 10 years old. So can COVID-19 become another kind of virus?
So that's a really interesting question, and this is another one that scientists are watching very carefully. So all viruses have a genetic code of instructions and that set of instructions is always changing. And most of those changes probably don't matter. But every so often there might be a change that makes it maybe a different shaped key.
Right.
And that might affect how it interacts with people and how it makes us sick.
Because it needs a new lock.
Right, exactly.
So if it forms into a different kind of key, maybe humans don't have that lock, but animals do.
Exactly. So it could go either way, or there could be a change that actually makes that key even stickier, and that makes us, or if we've developed a vaccine for one version of the virus, it could change, and now all of a sudden the vaccine doesn't work anymore.
Right.
So scientists are actually collecting samples of the virus from people who have gotten sick all over the world. Mm-hmm. And they're studying the instructions in each one of those samples. So we can start to get a sense of how this virus is changing and what that might mean for the future. I think here's another question that scientists are thinking about a lot from May.
She is 10 years old. So how long will the virus last? So some people say that it'll end in the heat of the summer, but we don't know.
We don't know. I think everybody hopes. If we hope that this virus will help make our life easier, we see other viruses that seem to go down a little bit, in hot weather. Often because viruses need humidity and moisture that once it gets higher, it's not as easy for the virus to survive. Mm-hmm. The thing is, we just don't know with this virus. It's only been around for a couple of months. So we don't know whether it'll go down. And even if it does go down, there's a chance that
it might not go away. It might climb back up once the summer's heat is over and it gets back to winter and fall where there's a lot more moisture.
That's right. As we're staying inside and in more... So that's one of the things that scientists study when they look back at diseases from the past. So in fact, almost 100 years ago, in 1918, there was another virus that went around the world, and it was a flu virus. And what we saw was that there was a lot of people getting sick in the spring. It kind of went away in the summer, and then it came back in the fall. So to know how long it'll last is just going to take some time. And again, it'll depend, once we start developing some more drugs that can help people get better, or a vaccine that can help people not get infected at all, that's definitely going to help as well.
So, Anja, who is 7 years old, would like to know if it is safe to go outside for a walk.
And the short answer there is yes. It is a beautiful day out here in Philadelphia, and going outside is good for you, not just to get some exercise, but also just, to make you feel better, But the important thing is that you still stay 6 feet
away.
apart. Yes. So go outside, get some fresh air, but stay 6 feet away from other people. So again, you're not contaminating each other potentially with the virus. The other thing, Asha, that we just got an email from your school saying that playgrounds are shut down.
Right.
What's the danger there?
So, playground materials don't get cleaned. So, if somebody has coronavirus and they don't know it, and they go out to the playground and touch all the playground equipment, and then somebody else comes along for some fresh air and touches some of that equipment that the kid before touched it, then that next kid will get it without knowing it.
That's
and
right.
will spread it. So this is basically just trying to slow down how much the coronavirus spreads.
Exactly. And we don't have a good sense of whether touching surfaces like playground equipment, how big of a role that plays in getting other people sick, but scientists have studied how long a virus can survive on things like plastic and steel and all of those things that playground equipment are made of. And they can survive there for days. So we don't know entirely, how effective that is, and then somebody else coming along. But anytime there's lots of kids playing together on a playground, you never know. You never know what could happen. Okay, this is a great question from Simone, who's 9 years old. You want to ask?
So, what country is getting hit the hardest with?
Yeah. So what's been really interesting to see is as this virus starts to affect different countries around the world, what makes a difference is how prepared different countries are to tackle it. And we know that China was the first country that that was affected, and initially it hit them very hard because nobody was prepared for it. But they acted very, very quickly, and so now we're seeing the cases in China at a very low level. So they seem to have kind of hopefully gotten over that first hump.
Right.
We see other countries in Asia who have managed to control the outbreak pretty well, again, because they've been prepared for it. And so that's kind of the question now for a lot of countries who are in this next wave of dealing with the infection.
Right, what country is going to do what they can the best? Is it going to be the country that started with it, like China, because they've been they have a lot of research for it,
right?
Because a lot of people got it, or is it going to be a country that doesn't have a lot of it and has been preparing in case there's a big outbreak?
That's right. And one of the stories that we're hearing right now is that maybe the U.S. wasn't as ready for it as we could have been. We were hearing a lot of stories about doctors who don't have the equipment that they need to help them, stay protected while they're treating other patients. And all of those things are going to make a difference. But we were talking with, a friend of ours in South Africa, and they were saying that South Africa has a lot of experience with dealing with diseases, that can spread from person to person. So they're hopeful that, maybe the disease won't have as big of an impact there.
Right.
I think we talked about this, but I think it's important to repeat this one. Is there an incubation period for the virus before symptoms start showing up?
Right, like you said, 14 days.
Up to 14 days, right? Anywhere from 2 days to 14 days is what scientists have noticed. And so that's why, again, it's really important for all of us to stay isolated. And here's a question from Naniba, who's 11, that how do you know if you have COVID-19 when you don't have symptoms?
So, you don't.
You don't, right?
You don't know, and you just have to be extra careful anyway.
Exactly.
6 feet away, wash your hands well, even if you might not have it.
Right. The best way that that you might guess is that if other people or have been in contact with have gotten sick, But that's one of the hardest things about this disease in terms of getting it under control. This is a good question.
This is from Maddie and Noah, who is age 9 and 7. Are there any countries making a vaccine for the coronavirus? So we don't know any vaccine for it yet.
Well, there aren't any vaccines yet, but lots of countries
are trying.
Yeah.
And we don't have any yet, but eventually we will, and as soon as it does happen, we'll know about it.
Right. So the two countries that are farthest along right now are the U.S. and China. And so we're all kind of keeping track of how those vaccines are getting tested to make sure, again, that they're safe and they're effective. So Cassandra, who's 10 years old, is asking where was the biggest outbreak? And this week, it turns out that the biggest numbers are right here in the U.S. Mm-hmm. But one thing to think about, though, is that even though the U.S. may have the total number that is the largest, the outbreaks in the U.S. are spread in a couple of different areas. And so this may still continue to grow and spread in the U.S. In ways that differ from city to city, depending on what each city or state is doing.
Right. So this is from Ryan. How well do masks protect you? So they don't really protect you from other people, except for a little bit where it covers your mouth. Except the rest of you, it's still going to be able to touch your skin and stuff. But more, it can protect other people from you because it's going over your mouth and your nose, which is where you breathe, and which is where it comes from to spread to other people.
That's right. So if you're sick, it is really important for you to wear a mask, again, to protect other people. What we know is that you may have been hearing all of these different terms like an N95 mask, versus maybe you or your family or friends have been sewing cloth masks, and so these different types of masks can help in different ways. So those really those sort of industrial medical masks, those are most important for doctors and and nurses and other people who are working in hospitals to try and keep them protected. It's also important for people who are sick, like Asha said, so that their germs don't get on other people. But we're seeing more and more people just wearing masks as they're going out in public. And, even though like a fabric mask that you might make at home isn't going to protect you from the virus, it's still helpful in reminding you not to touch your face, right? Okay. Let's take two more questions and then we'll wrap up. So Sarai is asking, what makes a virus a pandemic? That's a word that we're hearing. What did you notice in terms of when we started calling it a pandemic?
So we started calling it a pandemic when people were starting to stay home and were more aware that they need to be washing their hands.
Right, so there's actually, I think that's very much tied into the idea of a pandemic suddenly raises people's awareness of what they need to do. But there's actually a very technical definition of a pandemic that scientists use, and that's when a disease spreads very quickly across the world. So if there's only, just one country or just little outbreaks of it here and there, that's not yet a pandemic.
Right.
But what we saw, and I think what you noticed, is that when it suddenly happened and spread worldwide, that became a pandemic, and that then kind of just raises people's awareness as a good thing. And then I want to clarify this question too from Mark.
Okay, who's 9 years old.
So he's asking, is the vaccine a prevention or a cure for COVID-19? And that's a really important difference too.
I have a question about that.
Yeah.
So didn't you say a vaccine and a cure were two different things?
They are. So a cure can help somebody who already has a disease.
Right.
And there are lots of different medicines that are being tested right now to find things that can help people who are already sick.
Right, so a vaccine would be like whatever was inside the shot that you got, like your flu shot. That's the vaccine, because if you don't have the flu, that's going to prevent it from any chances of you getting.
Exactly. So a vaccine is there to protect you from getting sick. So that's a great question to talk about. So Asha, what's our last question to end up with?
So how can kids help? So you can start by staying 6 feet away.
Yeah.
And washing your hands really well.
Uh-huh.
And you can also just remember to remind other people.
That's right. And be patient with your grown-ups. we have some trouble with that sometimes, and it's hard, when you have to stay inside most of the time, you can't see your friends, but all of that is really important, not just to protect ourselves,
Mm-hmm.
but to protect the people who are out there who are the helpers, doctors, nurses, the people who are, picking up our trash and keeping us with, supplied with takeout food, who are working in our grocery stores, right? We couldn't keep living the way we are living without their help. And so everything that every one of us does, and kids are just as important as everybody else. Stay calm, don't freak out, stay home, and stay safe. Right?
Yeah.
Sounds like a plan?
Uh-huh.
All right, high five. Thanks everybody for joining us today, and hopefully we'll get to keep sending your questions. We'll answer some more in the comments. All right? Thanks a lot.